Good morning, Dr. Anthony. Thank you for joining us for today's COVID-19 update. Can we have a breakdown of vaccination numbers for children ages 5 to 11 years per region?
In terms of vaccination for the 5 to 11, we have done overall 5,324 doses, first doses. That's approximately 5.2% of that age cohort. And in terms of second doses, we have administered 876 doses, or 0.9% of that age cohort. When we look at the regional disaggregation, Region 8, they have 306 doses, first doses. And so their coverage, first dose coverage, is about 20.2%. So in terms of, because they have a relatively small population. So that seems to be pretty good. Region 9, they have actually administered 538 doses. And so they have a coverage, a first dose coverage of 16.2%. Regions 6, they have done 1,775 doses. They have a 11.8% coverage. Region 5, they are at 479 first doses. They have a 7% coverage. Region 3, 974, they have a 6.6% coverage. Region 7, they have 102 doses they have given out, so they have a 4.1% coverage. Region 4, we have given out 984 doses here, so that's 2.3% coverage. Regions 1, they have done 67 doses, you have 1.8% coverage. Regions 10, they have done 77 doses, so that's 1.4% coverage. And regions 2, they have done 22 doses, and they're at 0.3% coverage. We have actually gone to a lot of the regions where people are hesitant and did these types of workshops, both for people from the community and from healthcare workers, empowering them to talk to people. But I think a lot of people are very complacent. A lot of people feel that they don't need to get vaccinated, and therefore um, it's not so much hesitancy now as complacency. So I think that is a major challenge. But what we have now clinically is the BA5 that is circulating, and this one is very infectious, so a lot of people are going to get infected. And in fact, in the US, what they're saying now is 3 of every 4 cases that they have are from BA5. And this is now causing an increase in hospitalization as well. The WHO just yesterday pointed this out as well. So they have a tripling of cases globally, and you have a doubling of hospitalization. So it is not something that we should treat lightly. Now, one way of avoiding severe infection is through vaccination. And I think we have to reinforce that message so that our population can understand that. So now is not the time to be complacent. If more than 6 months have gone by since your last COVID shot, then you're eligible for a booster. In terms of cases, we have seen 114 new cases in the last 24 hours. We currently have 911 persons who are infected with COVID. And again, as I keep putting a caveat to this, this is only the numbers that we have, because there are lots of people who might be infected. To them, it looks like a flu, but if they go and do a test, it probably is COVID, because the presentation now, you see a lot of flu-like symptoms. So unless you test, you wouldn't know that you have COVID. So the 9/11 is really an underestimate of the cases that we have. Currently, we have about 30 persons in hospital. We have 19 persons at the Ocean View Hospital, with 3 of them in the ICU. In terms of the other vaccination numbers, 12 to 17, for example, first dose is 35,262 doses. That's 48.3% of that age cohort. Second dose is 25,805, or 35.4% of that age cohort. In terms of the adults, 18 years and older, 444,604 doses. That's 86.7% of that age cohort. And second dose is 344,337 doses. That's 67.1%. Booster doses, we are now at 70,349 doses. So again, we need to get more people boosted, and we just need to encourage people to go and get the booster doses.
Thank you very much, Dr. Anthony, and thank you for your time.